We are back, and tonight I'm going to be joined by clinical psychologist Dr. Bruce Levine. I want to talk to him a little bit about how all these kids in schools are being suspended and expelled for things like bringing a paper gun to school. Now, he's authored actually several books, including Surviving America's Depression Epidemic and Common Sense Rebellion, Taking Back Your Life from Drugs, Shrinks, Corporations, and a World Gone Crazy. He joins us now. Thank you for coming on today, Dr. Levine.
Sure, great to be here.
Well, okay, since the Sandy Hook shooting, we've seen, for lack of a better word, people are basically freaking out over guns in this country, and our government is now openly trying to restrict our Second Amendment. And in the last couple months in schools, we've actually seen a lot of incidences of children being suspended and expelled for bringing toy guns to school. We've seen kindergartners get expelled for playing cops and robbers on the playground and using their finger as a gun and saying "pow." We even saw a little girl with a piece of paper. It was shaped like an L, and they said, "That's a paper gun, you can't have that." And they searched her in front of the class. They were calling her a murderer. Even a little 5-year-old with a Hello Kitty bubble gun, they said it's a terrorist threat. And these kids are having nightmares. They're crying. What does it do to these little kids when they do this to them in their school?
Well, certainly when adults overreact and show poor judgment and suspend, expel young kids for doing that kind of thing. I mean, one of a couple of things are going to happen depending on their temperament, depending on these kids' personality. Some of them will get very depressed and feel shamed and feel something's horrible about themselves. It'll be traumatizing. For some of these other kids, they'll just it'll be an early experience of having no respect for authorities. They'll immediately think these authorities are idiots. They don't know what they're talking about. So those are some of the different kinds of reactions that kids will have when adults use really poor judgment and overreact.
Well, I mean, does a 5-year-old even really have a concept that their little toy is a gun or their finger saying "pow" is a threat to anybody? I mean, do they even really understand that?
I think they're thinking they're just being kids. They're not thinking that they're doing anything violent. And for most of society, a 5-year-old pointing their finger and going bang and playing cops and robbers prior to all these school shootings, prior to Sandy Hook, would have not been noticed, and nothing would have been stated about it unless it was going on in a classroom and it was disrupting some kind of teaching, which is not the case with these kids.
Well, doesn't it, I mean, it doesn't just affect the kid that's being punished either. It also affects all the rest of the kids in class. It's sort of like a group brainwashing almost, and saying that guns are bad. We need to not even look at a gun, don't play with a gun, don't even think about a gun. Right,
but I think part of it is that on these extreme examples, in some ways we're missing the larger, scarier point. These examples that you're talking about, they certainly have gone on where teachers and administrators have used colossally horrible, overreacting judgment here, a lack of judgment. But that's less scary for me because those are a handful, not that many events have happened on that kind. I mean, every one that have happened, we're going to see on the news. But the ones that are happening, millions of events are happening all the time where kids are normally going through being depressed or maybe obsessing too much on something or having anxiety. And these kids are being labeled and pathologized and put on medications that we now know are often making these kids more likely to commit violent acts. We know these from the statistics.
Well, actually, that brings up my next point, because a frequent contributor to InfoWars, John Rappaport, wrote an article about all these incidents, and he said that it's really more like an operant conditioning kind of thing for a thought crime, where they'll say, these are adverse thoughts you're having when you have these little guns or you play cops and robbers, and use that as an excuse to then later put these kids on psychiatric medications.
Well, I don't think a lot of these kids who are just pointing their fingers. I mean, psychologists, psychiatrists, they are doing a lot of horrible things, but I mean, even a lot of those reports that you talk about, some of the psychologists themselves were laughing that these were overreactions, and lots of kids who are just pointing a finger, a 5-year-old, are not going to be immediately put on Prozac or antidepressants. That's not the scary thing. The scary things are that there are millions of kids who actually are depressed. They actually have good reasons to be angry. They maybe are worrying a lot about things, and these are the kids who are being just easily, 5-year-olds, 7-year-olds, being put on medication, and we now know that there's a lot of strong negative reactions to these medications, that they produce manic responses, that a lot of these school shooters, we know documented over 66 of these school shooters have been on medications, been on antidepressants, been on these psychostimulants like Ritalin, and these are the really scary kinds of things.
Definitely. Well, actually, that brings up a good point, too, because in the president's executive orders that he issued after Sandy Hook, one of the things he said is that they want to get more young people on treatment. It just said treatment. Isn't that like saying they're basically going to put more young people on these drugs, which we know have side effects? They cause hostility, they cause increased suicidal tendencies, aggression, mood swings, all kinds of things?
That's the scary thing. Now, a lot of these kids really do need help, but mental health treatment, at least standard mental health treatment in America, is exactly what you said. It's like if a kid is labeled as depressed, and we know from the CDC in 2011, among teenagers 12 to 17, 3.7% are on antidepressants, which translates out to over 1 million kids in America are on antidepressants just in that age group. And we also know, and this is off of a manufacturer's report, the people who make Luvox, which, by the way, was the drug that Eric Harris, who was a shooter in Columbine, was on, that 4%, this is Solvay, this is their report, it's very conservative, 4% have manic reactions. So 4% using manufacturer's report of 1 million kids on antidepressant, that's over 40,000 kids who are going to have manic reactions. What's that? Poor judgment, impulsivity, agitation, sometimes even delusions, hallucinations. And that's off of the, lots of other folks who've looked at these things say that manic reactions are much higher. When these kids go off of these drugs, which they do because they're kids, they'll withdraw off of them. You'll have these extreme kind of what the antidepressant discontinuation syndrome, which is just a withdrawal response that can make a kid have akathisia, which makes you feel like you're coming out of your skin. And so we know just off of that one class of drugs, antidepressants, we've turned loose thousands of kids who are going to potentially do some things very destructive. And of course, kids, we've got 3.5 million kids in America on these Ritalin, Adderall, speed, ADHD kind of drugs. And we know that perhaps as many as 10% of these kids move into these kind of manic reactions and get diagnosed as bipolar. So there's another couple of 100,000 kids that we've just turned loose out there because the reaction in America today is when kids are having any kind of difficulty, when they're somewhat depressed, often for good reasons, or they're anxious, often for good reasons, we put them on medication, and we're not looking at these horrific adverse effects that when you look at them in the aggregate of these huge amount of numbers, even if they're small percentages like 4% become manic, well, 4% of 1 million kids on antidepressants is a lot of kids who could become manic and dangerous.
I've actually read several things in the last few days that have really disturbed me about SSRIs, one of them being that the fastest growing age group that's taking these medications is actually preschoolers.
Well, I haven't seen those statistics, but we know that in America, when I was starting out in practice 25 years ago, you would never see a little kid on these psychiatric drugs. I mean, the idea of pediatric bipolar disorder was unheard of. It was, the idea of labeling a 3- and 4-year-old with a bipolar disorder just seemed ridiculous. I mean, the symptoms of bipolar having to do with poor judgment and grandiosity and lability, all these symptoms were what people said was what a normal for a 3-year-old. And this whole idea of kids being labeled younger and younger with these kinds of conditions that are just kind of normal. Kids who are 3 and 4 years old who are just not paying attention because they're 3-year-olds or 4-year-olds being labeled with ADHD and be given these speed amphetamine type of drugs. This is all very new stuff in the last 10, 15 years, and it's terrifying. And of course, it's all driven by drug company profit.
Well, that's my next question, actually, because, I mean, there's been a huge uptick. We've seen an increase of like 400%, I read, in antidepressant use since 1988. Last year, it was declared that it was one of the #1 prescriptions in the age group from 18 to 44. I mean, we are using a massive amount of antidepressants in this country. I think it's 1 in 10 people now take it. Most people that take it for more than 2 years, the majority. And what is this causing this huge uptick in all this antidepressant use?
Well, just in this one class of drugs, we're focused on antidepressants. In terms of the whole issue of potential violence, school shootings, shooters. We know, for example, as I mentioned before, and viewers could look this up on, there's a lot of websites on this. SSRI Stories is one good website, but we know there's
Definitely.
66 documented school shooters, and that's not included. There's a lot of these ones people suspect. Okay, like this recent Adam Lanza, but that's not even included among the 66 because we don't have a coroner's report on that yet. But these are confirmed. The 66 school shooters have been on these different kinds of medications. So I mentioned Eric Harris on the antidepressant Lovix, the Columbine, one of the two Columbine shooters. Lots of these folks who are famous here. Kip Kenkel in Springfield, Oregon, was on Prozac and on Ritalin. The kid in Red Lake, Minnesota, who shot around 10 folks, he was on 60 milligrams of Prozac, and so it goes on and on. And we know that this is no accident because, again, as I mentioned before, a significant number of folks who are taking these drugs are going to have manic reactions. They're going to be what we call disinhibited. So when you take a psychotropic drug of any kind, whether it's Prozac or cocaine, all these psychotropic drug means that a drug that affects one's neurotransmitters, serotonin, dopamine, norepinephrine. And for many people who take these, you get the sense of being disinhibited, which means that you just do things that you would never ordinarily do, okay, which often happens when people use alcohol. It's just one of those things that happen when you're not on these kind of psychotropic drugs. Things pass through your mind that you never act on. You're not impulsive. You don't do anything about. But when you're on these kinds of drugs, you're much more likely to act on thoughts you would never act on. And if for kids who are walking around with a lot of rage, that spells trouble, and it has spelled some serious destructive trouble for society, for their schools, and for themselves.
Yeah, and we see these commercials on TV all the time. And when the commercials first started for these drugs, it was more specific about what your symptoms were, and it was like, ask your doctor today. And now it just seems like these commercials say, do you have emotions? Tell your doctor to give you drugs. I mean, it's amazing.
Right. I mean, and they know the people who make these commercials are very, very clever, very, very smart. They're smart enough to realize that they could put on these drug commercials, which, by the way, were illegal in America up until 1997 when the drug company Power convinced the government to allow these commercials on TV. So we're one of the two countries in the industrial world that allow these commercials on. And they're very clever. They realized that they could spend 75% of that commercial listing side effects, horrific side effects. If you actually listen to the commercials and don't mute them, which a lot of us do, including myself nowadays, I get so sick of hearing them. But it doesn't matter because the visuals of seeing a person who's upset and hurting and all of a sudden taking a pill and then the happy music and the happy smile, those are powerful manipulative forces that get people to ask their doctor. And we also know from lots of studies is once you go in and you ask your doctor for some Prozac or Paxil or any of these kind of antidepressants, you're going to get them. You may not have such an easy time scoring benzodiazepines like Valium and Xanax. Doctors are a little bit more reluctant because they've been taught those things are highly addictive. But you can score Prozac, Paxil, from any doctor very easily.
Almost like a candy machine.
Sure.
When did you become aware that these things weren't actually helping anybody?
When did I become aware of that?
That they were hurting more than helping?
Well, we've known for a long time. And anything you do in life is a cost-benefit analysis. And the scary thing about antidepressants is that we've known for a long time, and now this is finally being revealed in the mainstream press. It's actually 60 Minutes did a big story on this. Is that we know Prozac compared to placebo really doesn't work very well. In fact, in the majority of trials, when you compare Prozac or any of these antidepressants to a sugar pill placebo, the antidepressants fail to outperform the placebo. So in general, the effects, the positive effects of these antidepressants are really, we would be better off if doctors could still give placebo, sugar pills. And so there's not really great positive effects as there are with things like antibiotics are very important for certain people with certain infections. So there's very little scientifically in terms of positive effects, and there's horrible adverse effects. So in terms of a drug having been approved, these drugs should never have been approved when you consider how horrible the adverse effects are and how little any kind of beneficial effects. Now, that's not to say there's not going to be 25, 30% of people out there who take these Prozac, Paxil, Zoloft, who say, oh, it saved their life, it was great. But that's true for sugar pills as well, okay? So you have what we call